Okay, let's go. Final two issues of the day. The first one is what can medical students do to improve the situation? And then we'll end with just what is there any how to best educate medical students about these challenges and how they can be overcome. So what can medical students do? Are there things that they can do consistent with all of their other obligations and time constraints and where they are in their careers that we should spread the word to other medical students doing? Anybody have any suggestions? Okay, we need microphones. Where's our microphone person? Hold on.
Hey.
Sorry.
That's a little red shirt.
Don't make me
You saw the-
stand at the podium.
Jobs.
Yeah.
But I'm gonna be on this side because I'm gonna be writing.
Yeah.
Okay. So something that we were talking about is that medical students could sign some sort of petition and bring it to the administration saying that they would like these topics to be covered during their curriculum.
We've got two medical students and one law student that's going to write a resolution and present it to the Cuyahoga Medical Association
About
anti-retaliation statutes. And they're going to do it this year.
do they understand the process going beyond, once they start that, how they keep it going?
Yes, they do.
Okay. Okay, and what we need to know is their names so that when the statute is passed, it becomes the blank, blank, blank statute. And they are memorialized in history.
Oh.
Anybody else? Anything else? There's a.
I have a couple of suggestions just based on some things we have spoken about in terms of practicing doctors and some of the reasons why we're here. And one of the things that struck me is the sense of fear that physicians might have, and maybe medical students also have some fear. So to address that, I would recommend we stick up for ourselves, and I think this is one way of doing that is to become more informed, but also not to stay silent. I think maybe this can be intimidating if this is an area that we're not totally familiar with yet, but we will have to become familiar with.
So again, make it more of an effort to educate medical students so they are aware of this. And, instead of fear, replace that with the ability to take action and protect themselves and their peers.
Sure. And I think a second to that is speak up. If you have a question, ask it. Even in these forum type settings in a lecture, if you're wondering it, now's the time to ask it. Right now, this is the low stakes time. We're here to learn. So ask your question. If you have a view, if you want to defend something, defend the physician practice, then do it. The stakes are going to be much higher once we're out there practicing.
Excellent.
Thank you. So I have an idea. So for context for the people who are not case Western med students, we have a required class called Tuesday Seminar, which is also lovingly referred to as Touchy Feely Tuesday, because we talk about stuff like don't be racist, don't be sexist. Anyway, we had a recent Touchy Feely Tuesday on physician self care, and so we were lectured on how many physicians are burnt out and like mental health for physicians horrible, blah blah blah. Then we were offered breakout rooms to talk about like how much yoga could fix this. You know what I mean? So not to be cynical, although that is, I don't love. Yeah. Anyway, Tuesday seminar. I think we could easily replace that touchy feely Tuesday on self care with uh Dr. Batante and Teresa Barta actually talking about steps to like make things better for physicians so that you don't have to do 5,000 minutes of yoga.
Oh,
Like you don't have to cope with bad patient care because of preventable things. So I just think that Tuesday seminar might be a location for that, but I don't think it should be added like in addition to all the other Tuesday seminars we have because I haven't had touchy feely for a long time, but I feel like this is really important for med students to hear about. So that's my idea.
uh, Conti?
Professor Melman, I'm gonna put this on you a little bit and our medical school faculty. I think it's time that a fellowship be created that incorporates the principles of physician advocacy and patient advocacy, where it's taught at the fellowship level. Hopefully, these trained fellows could then go out and be part of the medical establishment. Because as it is now, organized medicine rarely they have presidents that are doctors, but rarely are their CEOs doctors. They're non-doctors. And so the physicians meet, they meet at 6 o'clock at night, they eat dinner in 20 minutes and they talk about these issues. And then they turn it over to a non-physician CEO. That is never going to work because the non-physician CEO is paid for only one thing, membership. You bring in members, we pay you your money. That's all they care about, membership, not really your well-being. We need fellowship-trained physicians to take those jobs over and lead organized medicine forward.
So who would sponsor or under what umbrella would the fellowships be? Would they be like fellowships like specialty fellowships?
Just like any other specialty, they would be a designated fellowship.
Yeah,
Yes.
that Accreditation Council on Graduate Medical
ACGME, American Council of Graduate Medical Education.
And I think both the leadership of this law school and the medical school, you're ripe to do it because you've shown the courage already.
Good. Other ideas? Well, okay, so a couple of thoughts. One is, there is a profession of patient advocates, and that hasn't been mentioned here at all. I'm curious, there are professionals who make a living basically representing patients in their fights with provider institutions and so forth. And I'm wondering if they have a role in, I don't know of any sort of liaison between them and, activist physician groups and so forth. Do we know much? Anybody know anything about that? Oh.
Professor Melman, you wrote the definitive article about patient advocacy years ago. And the flaw I find in it is that the patient advocate still has to go back to the physician and find out what to advocate for. You know, that's the problem with a non-doctor advocating. They don't know what to advocate for. They're great when they know what they're advocating for, but why should we place that burden on somebody else when the doctors in the room know exactly what to advocate for, but up to this point have been too fearful to do it?
A question, so we have our illustrious medical school professor, I don't mean to put you on the spot, but is it realistic at all to think about providing more of this, of this information to medical students? Or should we, just expect to be able to do it on these sort of ad hoc, at these sort of ad hoc events? And tell us about the advocacy track.
Yeah, well, thank you. First, I just want to give a huge thank you to Professor Millman for putting on this conference and being such a wonderful partner in developing these types of experiences for our medical students. So I'm Vanessa Meyer. I'm a family medicine physician here in Cleveland. I'm also the co-director of our advocacy and public health pathway. So CASE has committed to training physicians in advocacy and public health, and has developed a pathway for students to have experiences like this, but also be able to work in collaboration with law students in several courses. And I think it's really pretty unique. I think expanding pathway programs would be helpful. But, you know, I think we do talk a lot about interprofessional education, but we don't really know how to do interprofessional education. So, you know, having these types of experiences where we really bring law students and medical students together to have these times to learn from each other, to be inspired by each other, and to understand multiple aspects of the ways in which the profession can come together to live up to the ideals of each profession is truly unique. And I think that we do need to think about ways in which we codify that in medical school education. I'm not sure how we do that, but I would love to see more advocacy pathways. I would love to see advocacy as what we call a competency for physicians. So physicians are required to demonstrate competency upon graduation. And we as a profession talk about advocacy as a professional responsibility, but we don't talk about it as a competency, and we aren't required to demonstrate competency in advocacy. So the Council on Graduate Medical Education that we talked about really is our infrastructure to accredit our graduate medical education programs. I'm a family medicine physician, and as part of my graduate program, I had to demonstrate a competency in advocacy. And therefore, my educational training was designed to create experiences that allowed me to demonstrate that competency. Similarly, pediatricians are required to demonstrate competency in advocacy, and many hospitals are beginning to accept, and certain pediatric academic institutions are beginning to accept advocacy portfolios as an opportunity for academic promotion. But I would love to see advocacy defined by our academic institutions as a competency, so that our undergraduate schools in medical education are required to provide experiences for our students that allow them to demonstrate competency in advocacy.
So, not to be. So advocacy, so for example, the pathway that you described is advocacy and public health, right? And public
Right.
health pathway. So one of the things that you can advocate for is, population level public health improvements and things like that. So that's of course critical. Would that be sufficient? I mean, that we're talking about something a bit different, right? Patient level advocacy.
Absolutely.
So are those clearly sort of both, respected in the idea of these advocacy competencies, if you see what I mean, or they tend to focus on population and public health advocacy?
Well, I think it's so interesting that you mentioned a fellowship in advocacy because we do have a fellowship in preventive medicine. Was mentioned sort of the United States Preventive Task Force and the complexity that goes into understanding how to do preventive medicine, public health, population health management is understood as a discipline and as a competency. And we have a fellowship in preventive medicine. And so we have a clear professional designation of that competency as a fellowship. But we don't have a fellowship in advocacy. We don't even really have defined competencies as a profession in advocacy. So we do have a lot of literature, though, supporting a definition of physician advocacy, supporting some of the types of ways in which you would demonstrate physician advocacy in the physician portfolio. So there are certain academic constructs that really does make it ripe for defining advocacy within our academic institutions as a competency, but we're not there yet.
Comments or thoughts? Just a couple of things that weren't mentioned as things that we can do, not medical school focused, but we were told about the Minnesota statute that requires peer review to assess medical necessity in prior authorization, appeals and so forth. And certainly all state, I don't know of any other states that have that requirement, but that would be something that would be to have other states adopt. And also, when these statutes have, government enforcement mechanisms that are not being invoked, in part because of the, lobbying pressures of the interest. I mean, one of the things that would be good, I think, is to have, professional groups. I mean, the AMA, Council on Ethical and Judicial Affairs, the state medical boards, the state medical associations, monitoring the state government and at least making public the fact that, there was this retaliation, anti-retaliation, lawsuit or complaint that was resolved. Maybe it was settled, but now we're going to make the settlements public. What did the state government do about that? Did they do anything? And just at least follow up, and that I think would be something. All right. Well, I have nothing further to take your time with today. I want to thank everybody who helped put this together. It wasn't just me. We had a planning group. We have people who've come from out of town and all over to help us with their expertise and experience. And I want to thank them. I want to thank the students who took my healthcare controversies class and spent a lot of time preparing for this and made an enormous amount of contribution to this. So thank you very much, and thank you to all of our guests, both in person and remote. In the words of someone, let 100 flowers bloom. That was not safe, but this will be publicly available online probably sometime next week. That is this entire proceeding. So one of the things that we can do is to, if you think that this is all valuable and would be valuable for others, is to spread the word and say, if you're interested in, these issues, this you can watch online at the Law Medicine Center website for free, and it might be, enlightening for you, and we certainly welcome any suggestions from anywhere else. If you are seeking CLE and you are online, again, you need the activity code, which is 474140. And with that, I would like to say thank you and go forth and be healthy.
And since I have the microphone. I would also just like to, everybody, please give a round of applause to Professor Melman. We're so grateful for everything that you have done for our students and your commitment to teaching and making this such an important topic for our students. So thank you.
Out there, but Patty Harbold, who is the administrative expert, and put all of the administrative tasks together, and our audiovisual experts who help the students. Thank you all so much.